loss in the context of medicine, health, or physical fitness is a reduction of the total body mass due to a mean loss of fluid, body fat, or muscle mass. It can occur unintentionally due to an underlying disease, or it can arise from a conscious effort to improve an actual or perceived overweight or obese state. Weight loss among older people, often due to conditions such as cancer and heart disease, has been associated with an increased risk of disability and mortality. On the show today, we're discussing weight loss in older adults. I'm Okoyemi Akpati, and this is Weight Matters. We'll be right back. Welcome back. This is Weight Matters. Today, we're talking about weight loss in older adults. My guest for today's show is Dr. Edunjobi. You're welcome to the program, sir.
Thank you very much.
Okay. Now, if you take a look at, a family album, and you look at an individual from maybe when he was in his late teens, in his 20s, and then you fast forward to him being in his 40s, what you see is maybe an increase in the size of the head or even the face. The waist has thickened over the years. The person has maybe added 2, 3 dress sizes. It seems as if as we grow older, we tend to add weight. Why is this so?
Thank you very much. I think, I hope you're not talking about the male gender alone.
No.
It seems
No.
This applies to both.
Yes,
genders.
definitely.
Now, when you look at what you just described about the albums and coming back to the age of 40 and above, we're looking at it from two perspectives now. There's a good part and the other part. Now, the good part, which I wouldn't really call good on the long run, is the fact that we've been exposed to a lot of westernization and technologies. Now, westernization affects even our diets now. There are lots of people who don't eat what we used to eat in those days. I wouldn't say we, there are older people more than myself who have eaten directly from the farm,
Yes.
produce and all that. But these days, we eat all the foods that are prepared, garnished with salt, with fat, with oil and all that. So westernization of that is one of the reasons why that is in the first instance.
Okay.
Now, the other part, there are lots of economic realities we have to come to terms with now.
Okay.
When a graduate could not find a job, looking for a job everywhere, there are lots of people walking on the streets of this country depressed. You would know, you'll be surprised the number of people that are on antidepressants in this country. You understand? And most of these are steroids. And by the time you're exposed to steroids over a long time, you're prone to developing all these obese features.
Okay.
Now, apart from that now, the typical housewife, that's why I said they shouldn't be a main thing alone, doesn't grind pepper with the hand any longer. I mean, does not do most of the work. You can stay on one spot and control your blender with a remote, control your TV, control your washing machine and all that. So we seem to be more sedentary these days. So these are reasons. Then ultimately, what we should not overlook is the fact that there are genetic predisposition. A lot of people are prone to developing obesity, whether or not they eat all these Western diets.
Okay. All right. Another thing that, people can talk about is the fact that an individual's metabolism slows down as he grows older. Do you think this is true?
Well, it's a fact that this does happen, but there's an interplay between that in a particular individual and what happens around you.
Okay.
So we talk about environmental factors. Somebody that whose metabolism is slowing down and is on alcohol, there's no way it will help matters. And we've known so much about non-communicable diseases. They don't work alone. Somebody that has hypertension is likely going to have the myriad of other communicable, like the type 2 diabetes mellitus, obesity combined. So there's an entity they call metabolic syndrome.
Yes.
You understand? So as you grow older, you are prone to, having slowed metabolism, right? But there are other things you combine with this on your own. that makes it more
If,
established.
for example, you have become,
I mean, you become more sedentary in
yes,
your lifestyle. You don't exercise.
you have a lot
What
of
you
money
take, you
now.
have
Somebody does
exactly.
everything for
I mean,
you.
you stay in one spot. You have 7 messengers, especially for women now. I mean, you have like 3 housemates and all that. So there are a lot of things that contribute to that, really. And if you are not exercising yourself, the body too will not, naturally, it will not be triggered to do, I mean, to go all the way. Unless you exercise it, the muscle bulk, everything will just be there seated. So they won't go all the way. So it's like,
And so, doctor, please tell us, for an adult that, you know, is gaining weight, or, you know, like you said in our environment, it's, you know, it seems to be a way of life, you know, when you have some money for you to become more sedentary. Are there symptoms that people can take note of, you know, that will tell them that something is going wrong with your system? Things that could begin to happen to an individual.
well, there are lots of things we need to look at here. It's a multi-organ thing now.
Okay.
It is the commonest thing amongst people who seem to be sedentary or gaining weight now.
Okay.
They'll have, I mean, joint pains.
Yes.
I mean, these are, everything will boils down to the fact that the weight-bearing joint will carry all the loads. Talking about the hips, the knees, and the ankles. So that's where it starts from. Person will complain of joint pains. It could be from the hip, the knees, the ankles. Then as time goes on, there could be obvious deformities. That's the common K and the bow legs, called varus and valgus deformities.
Okay.
That's on one side. Then there could be what we call palpitations. That's as it affects the heart. The other one was, let's say, the musculoskeletal system now. As it affects the heart now, you'll be having palpitations, and this is because you're gaining weight.
And what is the palpitations?
Okay, palpitations just means you'll be aware of your heartbeat.
Okay.
Your heartbeat will be beating fast, and what that is telling you is that there are cardiovascular, I mean, the involvement of your heart, there are complications involving the heart now. So
Okay.
complications could really affect the brain, the heart, the kidneys, the muscles, the bones, and all that. So they'll have myriads of symptoms. They could come down with anything. But unfortunately, if it is on the part of hypertension has no symptoms in particular. So that's why you see people, somebody in the bus stops falls down suddenly, and they tell you it's the work of his enemies. So there are lots of things going on. There are lots of time bombs going on around in town. But unfortunately, they'll see the symptoms, but they don't present early to the healthcare providers.
Wow, this is really interesting. Ladies and gentlemen, you have heard from the doctor. When we come back from our break, we're going to be looking at what we can do as we grow older so we do not become a statistic. Thank you. Welcome back. For those of you just joining us, this is Weight Matters, and we're talking about weight loss in older adults. Now, you'll be wondering, why is this important? This is because as we grow older, there's a tendency for our metabolism to slow down a little bit more, and as we get more comfortable, a lot of things might begin to happen to us that we may not take note of until it becomes really serious. I'm still with my guest here, Dr. Dunjobi, and he's been talking to us about some of those symptoms that adults can begin to experience as they grow older and as they they increase in weight. Now, we spoke earlier on about some of those conditions or symptoms that an adult will begin to experience as they grow older. Now, for an individual who is already experiencing this and who is looking at how they can begin to lose weight, what will you advise them?
Well, thank you for that question. The best approach, really, it's a multidisciplinary approach.
Okay.
Because if I advise you to see just any medical practitioner, it's not something that such a person alone could handle.
Yes.
There's a role of the nutritionist
Okay.
in this. There's a role of the physiotherapist in this. And if someone has access to a gym,
Okay.
I mean, this physical fitness exercises. So the doctor will see you at the outset and will advise you that all these people combined together would have a role. Now that depends on how far this has hit into the individual.
Wow.
Now depend on which other doctors. There are lots of subspecialties in medicine. If it affects the heart, the doctors in you may refer you to the cardiologist. If it's affecting the brain, for all you care, the person could come down with stroke. Those are one of the risk factors. I mean, all these sedentary lifestyles, you have your slowed metabolism, the blood is not moving fast, there's, I mean, stagnancy in the vessels. It will cause something a thrombus. It will just stay there because you're not active. Then the moment you move, it will embolize. It could go to the heart, it could go to the brain, it could go to the kidney. And these are complications that will come ultimately. So now it depends on what the person comes down with.
Okay.
That will depend where the doctor will suggest if such a person should go for treatment.
Okay, let's look at another group of people. You know, for adults that, you know, what we'll call older adults, you know, people maybe that are in their 60s and their 70s and have come to you as a doctor saying that, you know, they're overweight, they need to lose weight, they are experiencing some symptoms. You know, you can't just tell them to, you know, just go and watch what they eat. What will you tell someone like that? I think there should be a special way in which you will manage the situation because of their age.
Well, we all have to take responsibilities for what we do for such group of people. Nigeria is such a place where we abandon our elderly ones. So many of them are in isolation. Many of them are living alone. Many of them are depressed. So when they come to me, for example, as a doctor, I mean, you need to ask about the setting of their home, their relationship with their children, or for those that have grandchildren and all that. That's where you start from. You can't impose anything on such. If you ask somebody to be taking a certain kind of diet,
Okay.
an elderly person
Yes.
who is living alone, who will monitor the person's diet, who will
Okay.
prepare the diet for such a person.
Okay.
So that is why I said we all have a role to play in that. So what I would start with is now, if it's possible to call one of the children to come to the round table, we discuss, then we can start with that. Then, by and large, if the patient now has specific symptoms as at the
Okay.
time he presents,
Okay.
we can take care of that. Then in terms of nutrition too, I
Okay.
mean, we all know that somebody that is on the high side, or that is endowed, so to speak, we can advise certain diets, including the high fiber diets.
Okay.
That's what they take, and take plenty of fruits and vegetables,
Okay.
take plenty of water,
Okay.
and that's the work of the nutritionist really.
All right.
So that's why I said there are lots of people that should come to play. So those are things we need to do for such a people. We can't abandon them.
Okay.
We treat the symptoms, including, I mean, the psychotherapy is another aspect that we need to introduce in such.
For people like that who, you know, exercise or working out could be a problem, maybe because they already have, like you said, problem with their knees, problem with their hips, you know, their joints already have, you know, they already have some of these problems. What can they do?
Well, there are other things, like, apart from the physical exercises,
Yes.
you know, there are lifestyle modifications when you are treating.
Okay.
Those are the diets, if you have been smoking before, you stop it, alcoholics,
Okay,
you
okay.
abandon it. Then I talked about physiotherapy and all that.
Yes.
Then there are medications you can take too.
Okay.
Because as they grow older, as they become sedentary, they lose the body mass, the bone minerals becomes reduced. They have what we call calcium content, osteomalacia, osteoporosis, and all that.
Okay.
So there are some things you can actually introduce in terms of medications now.
All right.
So apart from the physical, we know that they cannot be subjected to serious exercises.
activities,
So
yes.
there are medications you can give the elderly
Okay.
that will help them. We have some antioxidants that you can
Okay.
really give them. You have some natural products that you can advise them to be taken. Then you advise them, no matter how old, no matter how, these are people that they can have friends around. If you want to visit your friends in the evening or in the morning, just stroll down. What we normally advise people like that is your last diet for the day must not be beyond 7 p.m.
Very
And
good.
by the time you take your last diet at 7 p.m., if you have 10 housemates, at that point in time, you clear the table yourself, you wash the plate yourself. That is enough exercise for the day.
Okay.
If the person does not do more than that, I think it's an exercise good enough. So those are little things they can introduce. Early in the morning, walk around the compound if you have a large compound. You can't ask them to be jumping around the street. For somebody that has arthritis now, by the time you keep jumping now, you worsen the symptoms. So
Exactly.
you walk around, fast walking around the compound, visit your friends, make sure you don't sit on one spot
do.
all the time. Then, like I said, your meals matter, then what you take last in the day must not be beyond certain times, and you do what I just suggested. So these are little things.
Looking at the diet, is it possible to put, you know, someone who is in those advanced stages, is it possible to put them on a low-calorie diet? I mean, we're told it works, but will it work for someone like that?
Well, we need to come to terms with the fact that when you're talking about diet, we need to individualize diet soon.
Very
You don't
good.
generalize.
Very good.
You say, okay, all elderly people that are obese should take a low-calorie diet. You'll be making a lot of mistakes.
Okay.
So you need to know what the patient presents with.
Okay.
You need to know at that point in time what such an individual is going through
All
before
right.
you can institute any form of treatment. So we don't generalize.
And especially for them, they have to, like you said, have the support of their family. That is what
families and
will,
all that, so-
you know, help them to
So-
maybe be successful on this.
on this program.
I want us to look at a bit some of the medical conditions. You know, let's just go back to some of these medical conditions that typically someone who is overweight will experience. Could you just tell us some of them, and then, you know, what we can do to help people?
Well, for the, we're talking about the elderly now. But
Yes.
elderly starts from 60, 65 in some context.
Okay.
But we don't wait until then before you start. If you can nip it in the bud at the age of 40 when they're still growing up,
Okay.
it will be easier for you to maintain.
All
Now,
right.
the commonest presentation that they have will still be what we mentioned earlier on. That's talking about the blood supply. Everything but to the fact that there's a reduced blood supply to the organs around, and that would affect all organs of the body. Now, if it affects the heart, there's something we call ischemic heart disease. It just means that the rate at which blood gets to the heart is reduced.
Yes.
They'll be having chest pain. You understand? By the time they start having chest pain, you know that there's something. Chest pain now, not on the lower abdomen. There are lots of people that mistake that with ulcer and all that. But chest pain that could depict a heart problem. So you can start thinking about that. And unfortunately for people that have diabetes, because this thing, like I said, does not come alone, they come together. If they have diabetes, for people that have these symptoms I mentioned, I call the angina-like symptoms, angina pectoris, must have had
Yes.
somewhere. For them, they don't feel those symptoms. That's what kills them faster. And the reason is that they have certain conditions which will mask those symptoms. You understand? So they don't really have that complaints until they are gone. So what they present with will be the affectations of all the organs: headache, blurring of vision, dizziness. I mentioned palpitations earlier on. That's the
Yes.
awareness of your heartbeat. Then when you are easily stressed, I mean, anxiety, well, when you walk a little distance and you start panting, like you said the other time, so that's another thing. They can have a swelling of the body. These are just symptoms of maybe the heart problems or the kidney problems. So right from the head to the toe, they can have a myriad of symptoms. But majorly, the blurring of vision should be a pointer, the dizziness, the palpitations, like I mentioned.
Okay.
Then when they are breathlessness on easy or mild exertion, you have to climb a flight of stairs and you start panting. You should start thinking of something is wrong in this system. And lots more. So these are just a few of the symptoms.
Dr. Dunjobi, we hear that for those, you know, adults who wish to lose weight because maybe their doctors have ordered them that they must lose weight, and maybe they're finding it difficult to stay on a particular diet regimen, that surgery is an option for them. Can you tell us a bit about that?
Well, it's a big thing. In the first instance, most of these surgeries are not done in this part of the world.
Okay.
But even at that, the conservative surgeries, there's something they call the bariatric surgeries that
Okay.
could be done. There are lots more. It's not my specialty.
Okay.
But the bariatric surgery is there. Then depending on where the fat is accumulated,
Okay.
I mean, there's a situation where you have what we call truncal obesity.
Okay, that
So
is
that's
around the waist.
around the waist, around
which is
the
very
tummy and
common,
all, which is very
yes.
common amongst people that have that. So there's a place for what we call liposuction
Okay.
amongst them.
Okay.
And there are lots more. But Unfortunately, we can't have that done yet. Then we need to combine, no matter what surgery you do, you're still coming back to maintain on oral medication.
Exactly.
So that is why the surgery aspect won't even be the ultimate, actually,
Okay.
because your system is still generating this.
Okay.
Fat.
So by the time you
by the time
are
you
done
are
with
done,
the surgery,
you still need to maintain with certain medications.
ensuring that you have good
To
habits
maintain,
like
yes. So still have to
eating
eating
properly,
properly, using your
exercise.
medications as I went due, doing exercises, and the surgery would help really. But
Yes.
it won't be it won't help in isolation, so to
Okay.
speak.
So for those who just think all I have to do is travel out and
do surgery.
get surgery done and that will be it. It
Then
might not.
when they go out, do the surgery, and come back to their whole lifestyle, they realize that they need to go back the next year to do another surgery. So
And
it's
that will not be good.
It's still a lifestyle. It's a lifestyle thing.
So people
You need to-
indeed must change
you must
their
change
lifestyle.
your lifestyle.
They must change the things they do. They must
For-
change what
yes,
they eat,
what
and they
they
must
eat.
change maybe even their associations.
Yes, the association is very important. There are a lot of things attached to that. When you're in a social gathering,
Yes.
especially for males, your friends are taking alcohol,
Yes.
alcoholics, they are eating the catfish, eating the bokotos and all that. You want to belong. Even if you have made up your mind that you don't want to do such things again, but because of what people will say, you want to satisfy people around you. So you must take a shot or two, and you add into your problems. It's somebody that probably will have had a chest pain before leaving the house, but because of what the friends will say. So that aspect of the social thing is also very important in ultimately achieving the goal you set for yourself to bring down your weight for some people that have obesity.
Wow. Thank you so very much, Dr. Gunjobi. It has, I've really learned a lot from this episode.
Welcome.
Ladies and gentlemen, we have talked about a number of things today that can help us as we grow older to ensure that we are not overweight and that we maintain a healthy weight. And also the things that we can do to help, members of our family that are in their 60s and upwards, and how to ensure that they're healthy and they spend a lot more time with us. Doctor's orders today is that as you grow older, ensure that you go for your medical checkups as at when due, and that you have healthy habits that you make a part of your lifestyle, which includes exercising and eating healthy. Thank you so very much for being with us today, and have a wonderful week. Thank you so much, Doctor.
You're welcome.
It has been very nice having you on the program.